So last month I was down at AADSM in Dallas, and I had a chance to speak with the outgoing president of AADSM, Dr. David Schwartz. And the question was posed to the group I was with: what can we do to help the industry grow and gain momentum? There are a lot of hurdles, there are a lot of obstacles in dental sleep medicine and getting the patients the treatment that they need. If it's focused on a dental solution rather than a CPAP solution, obviously there's some hurdles there in the sleep testing community, in the insurance community. There's just a lot of hurdles. So how can we do better? How can we make these two disciplines, dental and medical, how can we help them play fair, play nice, and do what's best for their mutual patient? And I spoke up at this meeting, and it seemed like it was well received. But in my opinion, from the perspective of reaching out to patients in your community through paid marketing strategies, that is the number one way that you are going to shift the minds of the medical community, and that is through patient awareness. When the patient goes and they see their primary care, and the primary care brings up that, hey, like, I believe you have some indicators of obstructive sleep apnea. We're going to do a sleep test, and I want to put you on CPAP if it comes back that you do have obstructive sleep apnea. That patient needs to have the ability to come to that doctor and say, actually, I know you're saying CPAP, but I saw this other option, and they call it oral appliance therapy, and apparently it moves the mandible forward and it opens up the airway. Is that an option for me? That's how you get the medical community to start considering and giving dental sleep medicine the attention it deserves, is by the patients telling their doctors what they want. And the only way to do that is if you're able to educate and get your message and get your treatment in front of your community. And the best way to do that is through paid marketing. And the reason paid marketing is so effective, specifically Dental Sleep Profits, we focus on Facebook and Instagram. The reason being, Facebook's user base, 57% of them are over 35 years of age. And on Instagram, 46% of its users are over the age of 35 years old. So it's the prime demographic. Number two, Facebook and Instagram collect an incredible amount of data on its users. Everything we say, everything we think is, Facebook knows it, because whether your phone is in your pocket, on your desk, or in your purse, your phone is always listening to you. These apps have access to your microphone. They can hear what you're talking about. We can use that to our advantage to help educate your community. When people are talking about snoring, CPAP pillows, management of hypertension, mouth breathing, all the associated comorbidities with obstructive sleep apnea, we can get educational ads in front of those patients, making them aware that there is another form of treatment possible. And a lot of times, when those patients are coming through our funnel, as a result of running those targeted ads, those patients already have a sleep study in hand 95% of the time. They've already been diagnosed, or they have not been diagnosed. And the only reason they haven't been diagnosed is because they don't want to go to their doctor and get prescribed CPAP. So when they learn that there's another option available, they're a little embittered. They're a little bitter toward their physician because their physician didn't tell them that oral appliance therapy existed. And with good reason, they probably don't even know that it exists a lot of the times. Or, they're just frustrated that they didn't know. They've been struggling for years and years and years. They're not sleeping in the same bedroom as their spouse or partner, and it's just really frustrating for them. And they're coming to you looking for relief. That is the number one way, in my opinion, how, as a dental sleep medicine community, we are going to advance this treatment and make it available to more and more people, and getting them into treatment with less and less hurdles, is if the medical community has a greater awareness. And the medical community is not generally open to hearing about how to treat their patients from a dentist. So the best way to do that, again, is by raising patient awareness and having patients, your patients, tell their doctor, tell their pulmonologist, tell their ENT that they want to look into oral appliance therapy as an option to manage their obstructive sleep apnea rather than just the default of CPAP. So if this was helpful, if you agree with that thought process, that patient awareness is the number one way that we are going to advance dental sleep medicine and make it more widely available and more widely recognized by the medical community as a legitimate form of treatment to manage OSA, then like this video, subscribe for more content like this. And if you want to learn more about what Dental Sleep Profits does and how we can help accelerate the growth of your dental sleep medicine practice, help raise patient awareness in your community, and get more cases delivered in your practice,